may collapse and shock. Bloat may be relieved by passage of stomach tube. If possible, you have got the same stomach tube to which we are going to pass it to the ruminants, we may pass it to the ruminants also. And sometimes there may be a regurgitation problem. Anesthetized ruminants are very prone for regurgitation. Voluntary or involuntary regurgitation is there. So at that time, ruminal fluid may gush inside the trachea and it may end up with aspiratory pneumonia. That has to be taken care. And risk of aspiration pneumonia is always there in the ruminants. And another problem is hypoxemia. Ruminants are prone to hypoxemia during anesthesia always. Their respiratory center is depressed and oxygenation should be monitored if possible, wherever there is a possible, or manual palpation of the thoracic cavity of the animal need to be done very frequently, or else and another thing is, most of the wild ruminants, they afraid of the human being very fastly. Their heart rate is increased 10 times more if you go and approach. Many of the animals, before you approach, they die because of the fear only, adrenaline rush. Hence, one need to be very careful, especially of those wild ruminants. Especially another thing is the position. Unlike the other animal, the preferable position is sternal recumbency whenever there is a possibility. Always make the animal sternal recumbency is the best position for any of the operations. And sometimes that is the another problem. The myopathy is also there. Ruminants are high risk of myopathy because the pressure atrophy may also occur, radial nerve paralysis may also occur, and pursuit should be limited to 5 minutes only. So that's why they are, or else the degeneration myopathy may also occur. Whereas unlike the large animals, they cannot sustain the prolonged recumbency. That's one of the important things you need to remember, especially the wild ruminants, maybe a antelope or a deer or whatever it may be. And sometimes there is hyperthermia. Ruminants are high risk for hyperthermia. Then immobilization should be avoided during warm hours, especially suppose it is 12 o'clock in the especially summer or in Ballari or other thing. Don't try to immobilize the animal and put it under some water or something else and bring it to a shade, then you can do it then. Sometimes most of the animals, they cause self-injuries. They go aimlessly, hit a sharp object and cause very frightfully and may traumatize themselves during the induction of anesthesia. That's one of the greatest disadvantage. And after induction of anesthesia, you have to involve yourself in treating the wound, etc. They get lacerated wound, you have to involve in suturing the wound, all these things, complication may happen. Especially the ruminants, they fright the human beings very highly, especially ruminants. And fear death is a very common phenomenon in case of the antelopes. So before approaching the animal, if you start giving some drugs, etc., the animal will die due to the fear itself. Hypercardiemia or cardiac arrhythmia may be the cause of the death. Sometimes they die due to the respiratory assault. And another thing is, especially in Western Ghat, bison is another animal which very commonly comes for the treatment of veterinary and very difficult to immobilize, especially the bisons. Very difficult. Maybe because of the number one, they are very heavy body size. A bison may vary up to 1 ton also sometimes, 1.5 to 1 ton, 600 kg is the minimum, and that is the thing. And if you induce the anesthesia, immediately it starts regurgitation, and most of the time, 90% of the time, the aspiration pneumonia is there. As we were there in Sharavati area, we used to especially administer xylazine, etc. to some of the wild bisons for capturing them. Then immediately it used to regurgitate, and we have to keep the head down as much as possible, and especially pronounced excitation is there, especially the wild bisons, and they what you call as they put a very peculiar voice, etc. They start bellowing, start excitement, they start pedaling, start kicking, everything is there, especially in the wild bisons. Not like that, just like very similar to our buffaloes. Especially buffaloes are very peculiar animals. You know that how to handle a buffalo, and it's very difficult to handle a wild bison. Then animals are dangerous to approach because they may kick at any time, and they have got very sharp horns, they may stab you also. Then always they should be approached with extreme cautions because they appear deeply anesthetized, but suddenly they will get up and hit you very badly. So, before approaching a wild bison after anesthesia, be careful. Especially stay away from that bison, try to stimulate it, then confirm that it is very well anesthetized, then only you can go. So, this is the dose range of the adult dose 800 to 1000 kg may be there, especially the females may be weighing for about 600 to 800 kg approximately you have to decide. And one drug is available, that is carfentanil, it is also once again need to be imported, especially wherever there is bison's area is there, you have to procure this drug, unlike this your zalazine. If you administer zalazine, severe omission will be there. So, the specific drug to be imported is especially the carfentanil. This is the drug to be imported, and along with the zalazine also, whereas the reversal naltrexone is the drug of choice. Wherever bison population is more and they come for frequent operations, you have to procure both of these drugs and keep them ready for this thing. Whereas the black bears, especially Ballari areas, the bears, they rush into the villages and frighten almost all the people. Then they will be always, they are very good tree climbers and sit in front of the, above the tree, and they will not be approachable for you. Then if you dart them, they fall. Immediately they get alerted and fall, then die. So, we have to calculate the body weight properly, then drug dosage has to be decided, and they react in a very different manner to the anesthesia. They recover suddenly, then they have been encountered in black bears, especially drug protocols, they recover very fastly. Then sometimes they appear deeply anesthetized, but aroused and attack sometimes the human beings. So, zalazine once again 2 to 3 milligram and ketamine combination is always better for any of the bear species, always it is better. Whereas the other drugs available are telazole, then metomidine, metomidine or any other thing, combination of the drugs. Whereas the reversal can be done only with atimoprazole. So, once again this has to be important. Even though you do not acquire this, especially wherever they, especially in Ballari or sometimes in part of Raichuru, the bears are there very common. See, the vets should know these drugs and get it procured from the Department of the Forest and keep it ready with your hospital always. Then wolf, sometimes the wolves are always the thief. They come to the village and pick up some poultry and smaller animals like sheep and goat and carry, and the villagers attack the wolf always. And at that time, they demonstrate convulsive activity with dissociative anesthetics. If you administer ketamine, there will be severe convulsions will come, especially to the wolves. We do not know why it comes. The ketamine, it's a dissociative anesthetic, but it causes severe convulsions. Many veterinarians experience this thing, and if convulsions are there, they can be treated with diazepam. Yes, there is a drug, and whenever there are wolves are there, especially in some part of Pavagada, there are a lot of wolves are entering. At that time, you have to be ready with the, apart from this one, zalazine, telazole and metodamidine. These are the best line of the treatment. And we can also use our drugs, zalazine ketamine combination with the reversal of a specific antidote. And many times they steal the poultry and other things. Farmers go for hit them. At that time they enter the villages, enter the farmer's house also. So, we have to use. And coming to the diseases, very commonly used antibiotics they are not different from that of the human, especially veterinary antibiotics. All these are available, penicillin G procaine, carnivores you can very safely administer without any test, etc. to 20,000 to 40,000 international units per kg, one of the safest drug, especially in case of any of the wild animal disorders, especially wound treatment, etc. Then apart from this one, enrofloxacin can also be used, which is a exclusive drug in veterinary practice. The long-acting preparations can also be used as the dosage of 5 milligram per kg, a routine veterinary practice. And amoxicillin, gram-positive bacterial infection, can also be used as 11 milligram, or if the dose varies also not an issue. And ceftiofur can also be used. Doxycycline, especially some of the carnivores get the erlichiosis, especially the foxes, jackals, etc. Then you can go for doxycycline. And wherever there is a urinary tract infection, most of the carnivores suffer the UTI. Many of the time after mating etc., they suffer from the UTI. At that time, amikacin should be administered 15 milligram per kg only for 3 to 4 days, and depending upon the culture and sensitivity, because it's a highly nephrotoxic drug, but it is very potent drug against the E. coli and Klebsiella infections. So gram negative infections, you can go for amikacin. Gram positive, you can go for penicillin or the broad spectrum enrofloxacin or any other thing. These are enough antibiotics to treat any of the wildlife disorders. So nothing more special is required. And if it is not, sometimes it's a what you call as resistant drugs, depending upon the culture and sensitivity, you can procure the higher antibiotics. Or else, starting from a crocodile to an elephant or a carnivore or a wild ruminant, you can use the same antibiotics without any problem, or except that amikacin, which is having lot of the nephrotoxicity and ototoxicity, both are there. Only we have to monitor the serum creatinine if it is required, if you go for 3 or 4 days, or else till 3 days nothing is required. Amikacin or gentamicin, both are the aminoglycosides. Only in the gram negative infections, urinary tract infections, and also in certain gram negative infections, amikacin can be put without any problem. NSAIDs are useful in case of most of the wild animals. Only thing is, of course, after this vulture episode, diclofenac has been totally banned, and the vultures, there is a lot of stories are there. In Pakistan, there is an episode that vulture population eradicated, and the scientists, they attributed that it is due to the animals. The doctors, veterinary doctors, indiscriminately used the diclofenac in cattle, and the carcass is thrown out, and the vultures have eaten it and vanished. And because of that Pakistan episode, the diclofenac is banned in India also.